we were discussing regarding the patient referral. So we learned from Dr. Gurada sir that it's not a matter of shame. We have to refer patients where at the right time to the right center. Because sometimes it's a matter of life and death. So how to tell to the patient or what to tell the patient and what are the words to use while counseling the patient that you are being referred to a higher center and you have so and so illnesses, some more investigations are required. Because if you mess up in the language, then the patient will be confused and patient may think that either the doctor is like incompetent. So how to handle this situation with words?
There are two important aspects we need to understand: when to refer and how to refer. Whenever we feel that the patient is in such a grave condition that he cannot be managed at my center, then he has to be referred to the higher center. That is the first criteria. Second thing, there are certain times when a patient comes to us and we feel that this is a condition which is better managed by one of my friend or my senior or my teacher or my guru. He is dealing this type of patient since many a times and he has a better exposure to these type of diseases. Let him handle and let me send this patient to a right kind of person. So with these intentions, we can send the patient, refer the patient. While referring the patient, what it should be conveyed to the patient and patient relatives. This is very important. So while referring the patient, if the condition is serious or which requires an institutional care or some higher center care, then that has to be brought into the mindset of the patient or patient relatives. See, this is the reason, that's why I'm referring you to the higher center, because it requires some institutional approach as our inpatient approach or number of more doctors required for this to handle, or else we need to convey in such a sense that you will be sending to an higher center which takes care of your condition much better way. So that is the reason we are sending you, or I'm referring you to the higher center. This is the one thing. When a condition is better handled by an expert or who is experienced in that type of diseases and handling such diseases, and if you are referring the patient to such a person, then definitely you convey this the same thing to the patient, that I can also give you treatment, but it will be a right thing that if I refer you to a person, one who is expert in handling these cases and your condition, definitely they will or he will going to take care in a better manner. So, and you will be in a safe hands for the further management. So that's the reason I'm referring you to higher center or particular doctor. So these are the words we can use it in a very convincing manner to the patient or patient relatives before sending them or referring to the higher centers.